So here at Bluegrass Dentistry, we have lots of options for cosmetic dentistry. It's something we really enjoy. It's kind of the icing on the cake. You can do everything from Invisalign. You can straighten your teeth. You can do whitening. We have core whitening, which really brightens up people's smile, makes them proud of their smile. You can do veneers. You can do bonding. You can do crowns. I mean, there's almost no limit to cosmetic dentistry and what you can do. And we are full service here, so between myself and the other doctors, you can get almost any service that you need to improve your smile. And I know a lot of people think when they come in, we just start prepping and they leave, with that beautiful smile. But the big part of cosmetics dentistry that's so important, where we have to make it so perfect, is all of the planning that you do before you ever touch a tooth. So if someone is interested in cosmetic dentistry, especially veneers or crowns, we do a diagnostic appointment where we take photos, we take impressions. The most important thing is to have the end goal in mind, what you want those teeth to look like at the end that fits the patient best. So what we do is either through a digital smile design or through a hand wax up at the lab, we already know what the teeth are going to look like before we ever start. And then we work backwards to know how much do we have to prep the tooth, what do we need to do here, what do we need to do there. And it's really nice that when you have that digital smile design or that wax up from the lab, the patient gets to leave that day and they get to kind of try out their new teeth before the permanent goes in. That way they can really see if they like it or not. So you've always got to have that end result in mind. What I really look for when I'm looking at a patient when we're doing our consult, face shape is very important. Their age, their gender is very important. We even measure like an interpupillary distance. We measure the thirds of the face. And you also want to know too, the teeth. You've just got to look at how high their smile is, how wide is their smile. Do they kind of have a nice big toothy grin? Do they want a big nice toothy grin? So you've got to take into account a lot of the proportions of not only the teeth, but the face. And there's also the golden proportions of the teeth. Your central incisor should be a certain amount bigger than all the teeth, coming out, so that everything looks nice and flush and like the way nature intended it. So we do have some people that come in and they want that really bright white smile, but I always have a conversation with patients about expectations and how the best dentistry is invisible. So when they leave our office and they're done, of course I want them to be much happier than they walked in the door. And I want other people to notice that something has changed, that they look good, something has improved, but I don't ever want them to be able to pinpoint that it's the teeth. I would be happy if someone walked up and said, "Hey, did you get your hair done?" Or "You just look refreshed today," or something like that. But we don't ever want them to know that it's the dental work. So it should just blend in seamlessly and look like it was always meant to be there.